interesting thing that is going to happen here. We are going to launch a healthcare innovation challenge. We are going to move towards the most sector that is facing a lot of disruption, but in a good way. It is also having so many innovations done in healthcare, right? So this segment will highlight innovative thinking aimed at improving efficiency, outcomes, and patient experience. Let's begin the Healthcare Innovation Challenge, and I'll invite Shantanu Gaur on stage to launch the challenge.
I'm sorry for that. So I'm the last person before the tea break, and I'm sorry to keep you waiting for that, but I have some, thinking of tea break, I have some really interesting hot use cases coming up your way. Perfect. So as we are at NASSCOM, we don't just talk about AI, we are focused on implementing AI for the industry. So this is one such program that we have with us, which is focused on healthcare. And in this program, we work with hospitals, diagnostic chains, health insurance companies, as well as medtech enterprises to enable the adoption of AI and other digital solutions. And we have done about 6 editions of this program, started way back in 2019. And in these 6 editions, we have worked with 30 plus healthcare enterprises, about 50 plus use cases, wherein we have evaluated about 700 plus solution providers, and we have 25 plus success stories with us. Of course, I will also talk about one of the success story. Now, what this program is a structured approach towards digital transformation, AI-led digital transformation, wherein we start off by working with the healthcare enterprises to understand their problem statements. We then we curate the best solution providers across our vast ecosystem of AI and as well as deep tech startups. And then we go a step ahead wherein we get into the implementation phase, wherein we start off with the pilots and the POCs with the curated solution providers. And finally, with those pilots and POCs are scaled up to full-scale commercial deployments. As you would see, there is a healthy mix of a lot of use cases which are mentioned over here. And these are both on the clinical side as well as the operational side of things. And so we have solutions deployed in ICUs, in IPDs, in OPDs, in the emergency rooms, and also on the operational side, in the billing, the admin, etc., and leveraging various kinds of technologies ranging from AI, IoT, robotics, AR, VR, and whatnot. These are some of the entities that we have worked with. And this comprises of some of the leading healthcare providers, leading hospitals, public and private, as well as the health insurance companies. So as I said, we have a lot of success stories that we have had. I want to shift the focus towards one of the success stories that we have recently implemented for a leading cancer institute, in which we enabled the deployment of an AI solution that helped streamline the compliance with DPDP Act, which is the Digital Personal Data Protection Act. Also, we have a leaders talk lined up today as well on the same. And if you are an enterprise, if you're a GCC, then DPDP Act is applicable to you. And let's have the video first, and then I'll talk about it. Can we have the video, please?
We live in an age shaped by artificial intelligence, where data moves faster than ever, transforming how institutions serve people. But speed brings responsibility. Across diverse public services, data breaches and leaks haven't just affected enterprises, they've made people's trust, privacy, and safety vulnerable. At Mighty NASSCOM COE, we work with startups and institutions to build solutions that are practical, scalable, and responsible. Kaga Secure, an incubated solution guided by the COE, is transforming traditional record keeping into secure digital workflows, protecting sensitive information while providing unmatched efficiency. Its collaboration with RGCI Hospital shows what meaningful innovation looks like.
Healthcare organizations are experiencing frequent data breaches these days.
As a head cybersecurity, my always concern is how to take care of my data, confidentiality and privacy.
Now, major challenge to this privacy was the paper files and scanned files, because it was not easy to establish the trace of access, who is accessing the data, when and for what purpose.
We have a huge patient footfall, so it was important to get it digitized and also abiding by the DPDP law. It was a huge challenge for us.
I went to NASSCOM for a help with a product that is AI enabled and that can help us accessing the data in a secure manner, ensuring privacy of the patient data. They offered a few solutions. One of them, the Kaga Secure, that we liked the most, helped us in converting all those scanned files into a database that is secure, that gives us perfect trace of who has accessed the data of which patient at what time.
Now we are able to access our patient's data. Sitting from the OPD chambers, the consultants can easily access, and since it is password protected, so the patient's privacy is also not compromised.
The AI solution enables in an automated way storage of data in fragments so that it becomes immune to hackers, prevented from breach, and it's not usable by anybody.
It is much more faster also, so the response time has improved. Our doctors now can see patients' scanned data in a matter of seconds.
This ensures optimization of the cost and converting the cost center to a profit center.
Commitment to our patient is still secured while it has made our life much easier.
We are happy with this solution, working on continuously enhancing it further.
When startups, institutions, and ecosystems come together, technology moves beyond pilots into real-life adoption, which actualize real-life impact in the society. At the mighty NASSCOM COE, we are committed to building digital trust and enabling ideas that truly serve India and the world at large, setting a benchmark for innovation with care.
You can shift to the PPT. So DPDP Act is one such thing. If you are an enterprise leader, regardless of the sector, it is the law of the land now. And if you are dealing with any kind of customer data, user data, patient data, then this is applicable. But it is challenging. So what we have done is, this is one of the examples in which we have operated in the healthcare sector to streamline the compliance with the DPDP Act. But regardless, since we are sector agnostic, if you want to work in this space wherein you want to comply, you want to leverage technology or AI or digital to streamline the compliance with the Data Privacy Act, then please feel free to reach out to us and we will be delighted to work with you. And as I said, I'm again stressing this is a healthcare program that I'm covering right now, but we are working with all the sectors for that matter. Now coming back to the program, what marks today is the use case launch of the 7th edition of this program, in which we have 4 use cases with us that have come on board. And we have some of the 4 leading healthcare providers who have nominated these use cases, which is Ujala Cygnus with coming in with generative AI-led patient counseling, Max for AR-based oncosurgical planning, Narayana Health for digitization of legacy medical records and creation of an SLM, as well as the PD Hinduja group, wherein they have nominated a use case again on the privacy side, but on OPD. I will be very quickly covering these use cases. Of course, we will be making these use cases live. It will be there on our official LinkedIn channels. So if you want to work with us with regards to nominating a use case, please feel free to reach us out. Yeah. And if you are a solution provider in any of these areas, again, please apply once you make the application live, which will happen soon. So this is one of the first use case, which is on Ujala Cygnus, by Ujala Cygnus Group, which is around patient counseling. And all of us know that most of the patients who are, of course, not from this sector struggle with, and I think all of you would agree with me as well, the complex technical jargons that are there in the medical documentation. makes our life even more difficult at a time that we are already suffering. So the idea is to leverage generative AI, wherein as a patient, if I put in my prescription, my medical documentation, I will then be able to get specific queries answered with regards to my treatment. This solution can also help me with certain follow-up or medication reminders. And again, this thing is something which is available 24/7. So I can also use it for chronic diseases, getting in certain vitals, and then which I can key in into that platform, and then the platform can tell me whether everything is fine or I should be consulting any of the clinicians. So this is one of the use case. Moving on to the next one quickly. Yeah. So this is by Narayana Health, which is any healthcare institution, and not just healthcare institution, but there is a lot of unstructured data that is there in many of the institutions across sectors. Now, this is specifically with regards to one of the biggest healthcare institutions in India. And they also have a lot of unstructured data which lies in the form of flat files or scanned PDFs. Now, the idea over here is to in the first phase, digitize all of that and then create an SLM which allows various kinds of stakeholders to derive value from unlock value, which can be clinical inputs or it can be operational inputs on the vast majority of data that is there already. So this is also another interesting use case. And then finally is a use case by Max, which is from their surgical oncology vertical, which is particularly for head and neck cancer cases because there are critical organs around that the surgeons have to navigate. So the idea is that we use AI to ingest the imagery data that is collated and create a 3D model, which is then visualized using an AR/VR. So what this does is that it allows the surgeon to simulate the intraoperative conditions and do a preventive planning of the onco-surgery. Also, it helps in training better doctors because then complex surgeries can be simulated. Next slide, please. Okay. So this is the use case again on the data privacy side, but this is this time around on the OPD side of things. And OPD is even more complex because of the various kinds of data that is being accessed in terms of prescriptions, in terms of diagnostic reports, billing, etc. And then this data is accessed by multiple stakeholders. Again, similar departments. So data privacy, maintaining that is a big concern. So the idea is that we leverage AI to ensure that if a consent mechanism has been shared by the user, then the data governance follows that. We also ensure that there are specific specific role-based access that is enabled to provide a complete denial or a restricted access of data depending upon the stakeholder access. And then also look at flagging any kind of compliance misses. And then finally having certain compliance dashboards which are mandatory as per the DPDP Act. Now this is the okay. Perfect. So the idea over here was to encapsulate all the use cases that we have on hand for this edition. And like I said, it is important that for us, AI is not just artificial intelligence, it is accelerated impact. So, and the power of AI lies in collaboration. So let's innovate and let's collaborate. And I would like to thank all of you for hearing this out patiently.
Thank you, Shantanu. So this is what NASSCOM COE exactly does. We become the enabler between the industries and the startups. You can meet Shantanu for more if you have any innovation challenge as an industry player or as a startup who wants to contribute to the solution. We will take a 10-minute break and we will resume sharp at 12 p.m. we will sharply resume. We have a lot in store, so make sure that you are here at 12. Thank you, everyone.
For over 350 years, Lloyds Banking Group has set the benchmark for heritage.